And I think, our understanding has improved over these years, and there's still a lot of learning to be done as well. But just with our process evaluation, so with the process evaluation, it operated at 3 levels. So we had the strategic process evaluation, whereby we talked to different sort of sector leaders across the district. So that might be around physical activity or health and wellbeing, or our partners in landscape architecture. So, kind of anybody who might fit into the physical activity whole system. And we also had focus groups with myself and Jan, led by one of our senior research fellows. And so the directors of Jump, we also talked to the other partners of Active Bradford. So it was kind of about understanding at that system level what's working for who, how, why, and when. And there was kind of like, what's the mechanisms that's underpinning change? That's kind of what we were doing at kind of this strategic, more kind of like system level. Then we went down to the neighborhood level. So the neighborhood partners were all of those people involved in those local action groups, and particularly looking at the different 16 work streams. So what was working for who, how, why, when, mechanisms underpinning that, the changes that we were seeing across those different 16 work streams and across those neighborhoods partners as well. So, how's the system working at a neighborhood level? And then we looked at children and families. So understanding children and families' experiences of taking part in Jump. And like Jan said, the kind of like the beauty of this way of working between research and implementation was we wanted, from a research perspective, to kind of work through the data to understand it in kind of depth and for that sort of more academic understanding. But actually what we could do was just, like Jan said, sort of immediately take it back to our implementation team and say, hey, this is, this finding's coming out. This is really interesting. This isn't working. What can we do to change that? And then we'd all together, our research and our implementation team, would have a meeting where we dig into something particularly and say, okay, what can we do differently? What might work? What might not work?